So, sir, I also wanted to ask you that because of the COVID-19 situation, a lot of new things have to be introduced. The sanitization process, all the PPE kits, all new equipments. So that definitely increases the overheads of a particular organization or of a company. So has that been taken into consideration, and how are you dealing with those extra overheads?
It's so nice, I'll tell you frankly what's happening. Our overheads have more or less not been affected at all because, we had been taking all these cares. Now, there could have been a nominal increase in, say, a PPE kit, which our staff, they have to wear. We have almost around 40 people. But, the people who are in direct contact with the patients, at a time would not be more than 3 or 4 people. So, our doctors and the people who come in contact, there we have the additional expense of PP kit, but the dental work which we are performing and the budgets involved in those types of treatments, this is a very nominal cost which can be easily absorbed. Number one. Number two, we found that, see, everything we have in house means we even manufacture the teeth, prepare them, even your CBCT, the three-dimensional X-rays, the two-dimensional OPG, and everything we have in-house. So, for that reason, it's become very easy for us to manage the patient in-house, and on the same day, we are almost able to complete the treatment.
Correct.
We usually don't like a lot of people to come to our clinic in just one day. We would like to finish. Now we have almost like 12 dental chairs. So, we can perform up to around 8 people treatment in a day, taking only a single patient in single room, for the
Great.
throughout the day. So,
That's
there is,
great.
so it is both safe and we are able to finish the treatment. Now, say for example, some people, they may be going a number of times, half of an hour, 15 minutes, 1 hour visits, and then they go like every week, and you have 30 visits, 20 visits. Now, instead of that, if we make it together and I give them 9 hours or 8 hours or 10 hours at a time, and at the same time, we are also making, means on one side the treatment is going on, the other side the impressions which you have taken, scans which we have done, the computerized digital format which we have, so their teeth are being prepared. So as soon as, like for example, a root canal is done or an implant is done, so the crown is already being prepared or the bridge is prepared, and then by the time you finish this treatment, they are ready, and fix it. So you save
That's
a lot
great.
of time. This is how we have been going about. So in a less time, acha, and during the rest period, that is when it is being made. Now, if say there is a gap of half an hour or 1 hour, then we find that we give the restroom to the patient. They have an exclusive restroom where their bathroom and everything is there in house, and then what they will have is the refreshments, the food, whatever they want, and that also is quite safe because we never allot a single room on the same day to another patient. So this is
Correct.
how so this has been a routine method of ours, and we have been following same thing in the pandemic.
That's great.